Hi, everyone. I'm Ben Gonzalez, and this is TDI. Well, we're wrapping up Breast Cancer Awareness Month, and that's the time of the year when we talk about both regular screenings and early detection and why those are important. So, we thought we'd spend a few minutes today to talk about how insurance can play into that. And joining us today is Essie Ergel. She's the HMO team lead here at the agency. Hi, Essie. How's it going today?
Good. Thanks, Ben. How are you today?
Doing well, thank you. So let's start at the very beginning, just the basics. Are your basic breast cancer screenings going to be covered by most insurance?
Yes. So breast cancer screenings are covered annually. Annual breast cancer screenings for women aged 35 years and up are
Okay.
covered by all major medical health insurance coverage. So HMOs, PPOs, EPOs all cover annual breast cancer screenings, and that includes low dose mammograms, such as those done for 3D imaging, also known as breast tomosynthesis,
Mhm.
and then digital imaging as well.
So almost all the, like you said, the major medicals. So whether you get that at your employer or you've gone out to buy a health plan, it should be covered.
Yes, that's correct. It includes individual coverage that you may have purchased on your own, and it also includes coverage through your employer as well, as long as it's major medical coverage, the HMO, PPO, EPO. Some of the other plans, such as specified disease or other
Hmm.
limited benefits, may not cover or are not required by law to cover. But definitely the major medical health insurance coverage, such as HMO, PPO, and EPO, are covered individual or group.
And generally, when we're talking about the kind of basic screenings, we're talking about mammograms. But what if your doctor recommends that you get something else or recommends something based on your history? Are those kind of things going to be covered as well?
Yes, so that would be diagnostic mammograms, and
Okay.
diagnostic mammograms are covered in addition to annual breast cancer screenings. Any conditions such as any abnormalities in the breast, or if you've had a previous history of breast cancer, those diagnostic mammograms are covered at least annually as well. And also, it has to be covered to the same extent as other radiological breast
Okay.
cancer screenings or cancer screenings. So it would be the same co-payment, co-insurance, and deductible if it applies as that is applied to radiological screenings.
Is that something that you usually have to get an order from your doctor in order to get qualified?
Yes, normally when you see your doctor, if you're having any abnormalities in the breast that would require a diagnostic mammogram, the physician would order that. Your provider or physician would order those.
So this is October, so of course we're seeing more news stories about breast cancer awareness. And one of the things I've seen lately is stories about genetic testing. Is that something that will be covered by insurance?
So, genetic testing in relation to breast cancer, it looks for mutated genes, the BRCA1 and BRCA2. And if there is a mutated gene present, it could indicate a higher increase in risk for cancer. So, if you have a family history of breast cancer or believe that you may be at an increased risk for cancer, you should definitely contact your doctor. And then your doctor will contact your health insurance coverage, and you can also contact your health insurance
Hmm.
coverage to make sure that any genetic testing and screenings are covered prior to you actually obtaining those services. Making sure that those are pre-approved prior to getting the testing will just help ensure that you don't get any surprise bills for testing.
Exactly. For sure. You don't want that. So, in all the cases that we've kind of been talking about, the different situations, if you have a question about what's covered and what isn't covered, what should you do in those cases?
Yes, so if you have a question about what is or isn't covered, you should definitely reach out to your health insurance coverage. There should be on the back of your identification card, a toll-free number or telephone number to
Hmm.
reach out to your health insurance carrier. You should also look at your plan documents, like your evidence of coverage or policy, to review and make sure that it has the coverage that you need, and also give you an understanding of what your cost share responsibilities might be. And then you could also reach out to us.
For sure, definitely. Like Essie said, looking at your plan documents, we're always telling people that the information is there in their policy, but sometimes it's difficult to read those policies, so you can always turn to us as well. Well, thanks, Essie. So if you have questions about your health insurance, maybe even where to find coverage, you can start on our website. That's tdi.texas.gov. We have a health plan shopping guide there on our consumer page. And if you want to ask a question, you can also call our helpline. That's 1-800 252 3439. So for Essie Ergel, I'm Ben Gonzalez. This is TDI.